So for our final speaker of the day, it's a registered dietitian, Inez Martincevic. Inez is a clinical dietitian practicing within the Division of Gastroenterology, Hepatology, and Nutrition at the Hospital for Sick Children in Toronto. Inez completed her undergraduate and graduate studies at the University of Toronto. In collaboration with her gastroenterology team, Inez cares for patients affected by many chronic diseases involving the gut, liver, and pancreas. She also participates in research endeavors that are looking to improve diet, nutritional status, and the quality of life for those affected by these conditions. And Inez is also a member of the Professional Advisory Council of the Canadian Celiac Association. Inez, thanks for joining us today.
It is an absolute pleasure. Hello, everyone. And I know it's been an information-packed day, and we're in the home stretch. I am super excited. I'm also extremely honored to be able to chat with all of you about the CCA's experience in using online education to share knowledge about celiac disease and the gluten-free diet. So bear with me as I do this screen share. I am certainly not tech savvy. So I am relying on you, Mark, to let me know that all is going well here.
It's just loading up.
Wonderful.
Stand by. Okay, we see it. You're good.
Great. Okay. By the way, I fully took that picture from the CCA website. Full disclosure, did not create that image. All right, so this afternoon, okay, wonderful. Okay, sorry about that. This afternoon, everyone, I am excited to share with you some information that is both, I hope, some new information. There's been a lot we've talked about today. There might be some things that you already know about. You might learn some new things. I'm trying to keep this as innovative as possible, but also to be able to share with you maybe some tidbits that I've learned over the years of working with both healthcare practitioners, but also individuals and care providers affected by celiac disease. So a little bit of background, we'll review the treatment, and you're going to hear this word treatment throughout this presentation a lot, and an emphasis on it because it does hold value to celiac disease, as well as the actual treatment itself that we all want to know more about, this gluten-free diet and what it means, but also showcase how we can use innovation. Like today, we're having a virtual conference. This is because of technology that hopefully all of you are sitting at home in your sweatpants, comfortable, being able to hear all of us and share your wisdom and your experiences, and how we use this technology also in research. And very much highlighting the research findings of using such tools in sharing the understanding and the management of celiac disease and the gluten-free diet. Just to let you know, healthcare practitioners, as well as the Canadian Celiac Association, very much understand that there's a lot of unknowns out there. And that's where research is paramount to understanding and learning more. And we want to continue to share evidence and to share research and findings. And that's why I'm so excited to be here today to tell you about this project that we started at CCA several years ago and now finally have data to report on. Okay, so we have to start with this kind of sort of medical term, celiac disease. And I have to tell you that when you search the literature, as we say, or publications, there's this definition of celiac disease, which is an immune-mediated enteropathy caused by permanent sensitivity to gluten in genetically susceptible individuals. Okay, what does that even mean? Okay, I find that in my clinical practice, I'm often an English to English translator, and this is a perfect example of where when you read about celiac disease, it might not necessarily make sense immediately. So an enteropathy involves the small intestine. An immune-mediated condition means that the immune system is involved. And I think many of you can appreciate that's why it's so important conveying your needs when you are either traveling like Mark does, or maybe when you are trying to explain to a teacher if you're child diagnosed, what you may or may not be able to participate in school activities, trying to explain to family members the seriousness of this condition. It involves the immune system. And the immune system is responding to something called gluten in people who have genes that are associated with it. Now, the one thing we still don't know is what causes celiac disease. That's sort of that million-dollar question. But when we talk about genes, it's also to highlight that we don't know why some people who might be susceptible to developing the condition actually don't ever evolve into having celiac disease. So what this tells us is that as much as we've learned about celiac disease, there's a lot more that we'd like to learn, and that's where research is so vital and important. The other unique thing about celiac disease is that it's very much on a spectrum. So we often talk about symptoms and how people are living with their celiac disease, but these symptoms are variable and they can be mild or they can be severe. Interesting fact that maybe not everyone knows, you can actually have celiac disease and not have any overt symptoms at all. And that symptoms aren't just those things that you feel from your gastrointestinal system. So not to sound condescending in any way, but certainly in pediatrics, and I work at sick kids, we often talk about the gastrointestinal tract being from gum to bum, okay? So some people experience symptoms that are gum to bum. So it could be things like abdominal pain, it could be bloating, it could be diarrhea, but that doesn't necessarily mean that that's where the symptoms end. Symptoms could also be related to malabsorption. And the malabsorption happens because the immune system is involved. And when the immune system is involved, in particular in celiac disease, it causes a reaction, a cascade of events that results in inflammation. And inflammation is one of those other, Latin medical terms that we throw out all the time. And we like to describe inflammation in pediatrics as being red, sore, or swollen, or any combination thereof, right? So because malabsorption is related to how nutrients go from the lumen or the inner part of the gastrointestinal tract into the body, for individuals with celiac disease that are not on the gluten-free diet, which could be either at the time of diagnosis or during your journey with celiac disease, that inflammation is happening whether you feel it or not. And when that inflammation happens to the tissue of the small intestine, it means that nutrients are not effectively or they're not well absorbed. And because of that, you can develop other conditions like anemia. Now, without having a whole talk discussing what anemia is in medical terms, it basically means that you could be very tired or experience fatigue because your body's not making enough hemoglobin, and your body makes hemoglobin in the bone marrow and it needs iron to do so. So if you're not able to absorb enough iron for your body to do what it needs to do, you develop another condition or another symptom, which may not be gum to bum. The other thing we know about celiac disease, because it involves the immune system, and the immune system is everywhere in the body. It's not just isolated to the small intestine, right? We've all been there. We've gotten colds, right? We've gotten sick before, and when our immune system is responding to something it doesn't like, pollen in the air. But in celiac disease, it can affect other systems, not just the gastrointestinal, like your joints or your skin, which, fun fact, is our body's largest organ. But in addition to knowing how individuals are affected with celiac disease, clinicians also want to know how the condition is evolving over time. And so we also throw around these other terms like prevalence and risk. And this is important for us to know because we want to know, are we doing a good job diagnosing, and how can we better help the larger community? So prevalence, for example, another term that I will now translate for everyone, prevalence means the number of people affected in a subpopulation. Okay, and so we know the prevalence of celiac disease, particularly in Canada, has increased decade over decade. Part of that is because research is doing a better job at diagnosing and creating tools and tests to better diagnose and better define. But it's interesting for the purposes of today's virtual session as well as tomorrow, because we want to know how many people are affected with celiac disease and then how can we better help them. So we know in Canada, as well as other countries in North America and the world, about 1% of the general population is affected by celiac disease. And so I say that to everyone today, first and foremost, to let you know you are not alone on this journey, but that also this isn't a rare condition. And in saying so, it's really important that with the entire community, that being clinicians, hospital workers, healthcare providers, but also the Canadian Celiac Association, to advocate so that we can do a better job of informing Canadians, informing food industry, informing restaurants, informing people so that it becomes common knowledge. Because I have to say in my practice, when individuals are newly diagnosed with celiac disease, it's often, I've never heard of this, or I don't have a family member affected. How did this happen to me? And so as we learn more about prevalence and risks and understand the condition, we hope that we can better communicate with others. Celiac disease can affect people of either sex. It can affect people of any age, and it can affect people of multiple backgrounds. So the uniqueness that Canada has in being such a multicultural community as well is learning how we can help people that come from other places in the world where maybe it's not heard of and be able to educate others together. We also know that certain individuals are at higher risk of developing celiac disease. And this is where the Canadian Celiac Association and clinicians can collaborate with other organizations like Diabetes Canada to be able to screen more and understand how celiac disease evolves in different people. So you're at higher risk of developing celiac disease if you have a relative with it, okay? That's that gene pool, that word genetics that we also like to throw around a lot. It affects also people at a higher proportion if you have another genetic condition like Down syndrome or Turner syndrome. And you're at higher risk of developing it if you have another autoimmune condition. So it's established in type 1 diabetes, you have a higher risk, but now we're also learning about how it might impact other people. For example, people who might have rheumatic conditions like arthritis or lupus. And so as we learn more about celiac disease, the other thing we know is we need to be able to share the treatment, okay? The treatment for celiac disease today, November, while it's raining outside in Toronto in the year 2021, the treatment and the only treatment for celiac disease, meaning impacting the immune system, reducing that inflammation, and helping improve and resolve symptoms, happens with a strict gluten-free diet for life. The research tells us that the sooner you start your strict gluten-free diet, and that if you stick to the gluten-free diet, okay, to the strictness of it, which we also in medicine call adherence, that we can actually reverse the damage that the inflammation causes to the small intestine. So that's that healing concept, that we can prevent the development of other conditions, which we refer to as comorbidities in medicine, that are associated with having celiac disease, but not necessarily being effectively treated, okay? And so these can be things like osteoporosis. And we can also potentially, at least we hope, improve the quality of life of the individual that's affected by the condition. But what is this gluten that everyone talks about? Gluten, another term we throw out all the time. And I have to say, when I was first introduced to celiac disease, I had no idea what gluten was. Okay, I had all this learning that I'd gotten in post-secondary education, and here I am reading this word gluten, which, by the way, when I started, and I'm dating myself, there wasn't Google, and I had to go to the library and sign out a book. Okay, I started to learn and probe more about what gluten is, but not in the context of this slide that you see here. I am not a botanist. I certainly don't know how, plants and other living species are categorized. I put this information up there to let you know that this concept of gluten is quite complex. But as it relates to celiac disease, we want to simplify it for people affected. So plants, just like us humans, are living organisms on planet Earth. And by being living organisms, they need proteins to sustain life. Gluten is the storage proteins of grains, and of the grains that we know that affect or elicit a response in the immune system of people affected by celiac disease. It includes wheat, barley, rye, any hybrid of these grains, as well as oats. Now, the storage proteins in oats is a bit of a controversial topic. And just to showcase to everyone here today, there is always a lot of research going on in the background, and not just in medicine, but also with our collaborators that are maybe botanists or that might work for Health Canada or elsewhere. So we're not quite sure about whether these storage proteins in oats are also triggering an immune response if you have celiac disease. The jury is still out, so we need more research to answer that question. But what we do know is that the only safe oats for individuals affected by celiac disease are those that are pure and uncontaminated. Now, oats, when they grow up out of the ground on a farm somewhere, they are naturally gluten-free. However, as both Nicole and Kaylee had discussed just before I went live, there's a lot of layers to where food product can be affected, or as we say, contaminated, as we go from farm to table. So we say the only safe oats are those that are deemed to be gluten-free if you have celiac disease. And I think what this does is it highlights also just how complicated and just how detailed the treatment or the gluten-free diet for celiac disease can be. And this is why so many medical societies around the globe have created these, we call them clinical practice guidelines. They guide clinicians to know how to diagnose, to know how to manage, to know how to treat, to know how to test, basically to know how to care for individuals affected by celiac disease. And they all unanimously say, you gotta have a gluten-free diet teaching with a knowledgeable dietitian, okay? Because we know that knowledge is power. And if you have that knowledge, you can actually have a very fruitful, pun intended, life. But the reality is that accessing medical care practitioners is not easy, not just in Canada, but around the world. One of our other colleagues that works with the Canadian Celiac Association, and she has been a huge voice for the celiac community for many years, Shelley Case, did this great study, a few years back, but she showed based on survey results that not even, a third, so maybe about a quarter of all patients newly diagnosed with celiac disease actually were able to access a trained dietitian to get a gluten-free diet teaching. That means that the majority of those affected, including those of you that are participating today, probably didn't get to access someone like me at CCA. The other thing we know is that Canada's huge. It's a big country, and there's a lot of rural parts to Canada. So while you might have a postal code that allows you to get connected with someone like me at a big hospital, not everybody does. And so the other thing that we definitely know is where you live might impact your ability to get information to ensure that you are doing what's in your best interest for your health. And we know this. We know this at hospitals. We know this in medicine. And we thought, okay, how can we use modern technology to be able to address these gaps? What can we do to fix some of these problems? So we thought online education, which I'm sure for many of you during this COVID experience is not a new concept. But trust me when I tell you, we started this project well before COVID. It's been years in the making, and we thought this was really innovative and an exciting way to be able to educate individuals affected by celiac disease. And we know that online education, also known as e-learning, hasn't just been shown to improve the management and the experience of people with celiac disease, but also multiple chronic conditions. So we thought, okay, let's take this e-learning idea, take our paper handouts, and you gotta love the day of paper handouts, everyone. I can't tell you how many times I got a phone call saying, oh no, I accidentally threw it in the garbage, or it fell into a snow pile, or I don't know where I put it. I need that information again, okay? So taking those paper handouts that we used to give, like those little pamphlets and brochures you'd read while you were waiting in your doctor's office for your tests, you know, turn them into an online platform where we could actually reach many and address the limiting resources of dietetic support in Canada. And so what we did was we turned this into a study. In a study, because it provides the evidence, it objectively looks at the data in order to better inform our colleagues and anyone across Canada. We did a study at CCA where we wanted to determine if e-learning modules can be used to not only educate pediatric patients and their caregivers that are newly diagnosed with celiac disease about the gluten-free diet, but also learn about their experience. We created these e-learning modules using specific technology, which I hope, fingers crossed, will work for us this afternoon. But we wanted to make it playful and interactive and not necessarily as laborious and boring as reading a handout. But we also wanted to make sure that it was scripted so that you were getting the same information as if you were meeting with a dietitian, and that there was no difference in the information provided. And so what did we do? We recruited patients aged 10 to 18 years, and we specifically picked children that were above the age of 10 because we know that there might have been other limitations to little ones participating in a study like this. Okay, we wanted to get the experience not just from a parent or caregiver, but also the patient themselves. And you needed to have a confirmed diagnosis of celiac disease to participate. So that was either biopsy proven or using the criteria from the European Society for Pediatric Gastroenterology, Hepatology, and Nutrition. So what we did was we randomized patients. So this means it's a method of chance, which is basically like flipping a coin. Sometimes it's heads, sometimes it's tails. And if you agreed to participate in our study, you would either get randomized to receive a one-on-one teaching with, just so happens to be me. So all the participants received teaching with me from the script that was created, or you were put in a clinical assessment room where you participated in these e-learning modules. And so I hope that this works. Oh, good, it's going live. So just to show you, this is what the modules look like. Now, this is going through it a little bit quickly, but I just want to speak to it, knowing full well, everyone, that you'll be able to access this information online as well. But you pick various different highlighted parts of the screen, and there's animation there to educate you on celiac disease. Because we feel that if you truly understand celiac disease like we do in medicine, it can provide you with that extra motivation to ensure that you are able to adhere to the gluten-free diet once you learn about it. So the first set of modules talked about diagnosing the disease. And the second set of modules go through all the details of what it means to be strictly gluten-free. And so here's another sampling of what the interactive modules look like. So we really try to focus on color, and we try to focus on terminology that is consistent across Canada, right? Because it doesn't matter whether you're diagnosed in British Columbia or Nova Scotia. You should be able to receive the same dietary information as it relates to the regulations that exist out there to help individuals. And so there was a little bit of fun and play, and not really testing, but just kind of sort of stages at which there was breaks throughout these modules so that people could really see whether or not they're getting it. Like, is this making sense to me? And so what did we learn? This is the exciting part. What did we find out from all of this? Okay, we had included 40 patients as well as their caregivers. And again, we always like to say caregivers because we appreciate that not everyone necessarily has that traditional sort of parent that's involved in maybe supporting their nutritional needs. It could have been a grandparent, or it could be a nanny. But we wanted this to be as inclusive as possible. So we had patients and their caregivers, and they received education, again, either from myself or from the modules. Now, I want to make this clear. These modules were not intended whatsoever to remove the importance of having the opportunity to access a dietitian when learning about the gluten-free diet. That is critically important because as you've learned throughout the day, there's so many layers and so many complexities to the strict gluten-free diet for celiac disease that even though these modules included a lot of information, there was still a lot of questions the participants had for a dietitian. So these e-learning modules were to help people get started and provide them with a lot of good information that can be shared across the community. So it didn't matter what your symptoms were like, and it didn't matter what province you were diagnosed in. It was that the bulk of the information could be shared, okay, in such a way that then you could have your more specific questions addressed. All right, so I just want to be clear, these modules are not replacing dietitians. What they are is providing both the educators as well as the community with tools. And so what did we learn? We learned that after 6 months of participating in this study, that both the patients and the caregivers had no statistically significant difference. And I say that because we always need mathematicians to let us know if the data that we're collected actually has what we refer to as power and whether it has true meaning, okay? So statistically significant results. So as it related to dietary adherence, we were looking at tissue transglutaminase levels, so that objective measure, but also scores from a CDAT. So this is a 7-item questionnaire that addresses adherence or sticking to the diet. We had a little test that everyone participating had completed. Oh, and by the way, just to clarify, patients and caregivers, when they were participating in any of the study questionnaires or tests, they were separated and they were asked to complete it on their own. Because we really wanted to know if the message was getting across, whether you were 12 years old or, 52 years old. And so again, gluten-free knowledge, no difference. between either getting a teaching with myself or doing the modules, or even, between the participants, we learned that GI symptoms had improved and quality of life had improved. The interesting thing for me that I learned out of participating in this study was that participants were also satisfied with the modules, and they enjoyed the modules as much as they did chatting up with me. Now, granted, I get that I get super bubbly and I do work with children and I get excited about, showing pictures of what villi are. But I just want to say that you also don't need to be a pediatric patient to enjoy and learn in this kind of forum. We all do. I think so. But what did we learn? What were the conclusions of the study? We learned that we can use inexpensive technology that can be fun and playful, but also evidence-based, okay, to support not just education, but also clinical outcomes at strategic time points after being involved in the study. Adherence was similar, knowledge was similar, and participants and caregivers were really happy with participating. So we learned that e-learning can actually facilitate education. It can help bridge some of those gaps around accessing resources, true knowledgeable information, regardless of where you live in Canada. This, by the way, can also be shared amongst caregivers. I think that was one other thing that I wanted to stress today. If you want to share this information with a camp counselor, you didn't have to worry about taking pieces of paper around with you in your purse saying, this is what they told me at Sick Kids, read it yourselves, or teachers or anybody that's involved in your life and or your child's life. This is the About Kids Health Celiac Hub, which I am excited to share with everyone today. It is available now online, including the modules. There's something where if you want to, take your time. You don't need to rush them, press pause, run it while you're having a great gluten-free snack that's high fiber, like Nicole had suggested. But also for everyone to know that any new upcoming research that we learn, any ability to collaborate with the Canadian Celiac Association as well to share information, anything else that we might be doing through the Celiac Clinic at Sick Kids will be updated on this hub, and it would provide individuals as well as the larger celiac community with up-to-date information. And granted, as up to date as possible, not minute by minute. So we know celiac disease is an immune-mediated condition. It involves the immune system, and that's really important to know as we share that information with others around us, particularly when we're trying to enjoy our lives. Okay, being able to do the things that, for example, we had chatted about earlier with Dr. Sarah today that are important to us and that we value. And that treating celiac disease does involve being educated and learning about how you can stick to it, even though it gets hard. And that it's exciting to be able to use technology now to be able to share with the larger community what we've learned and not just leave it to one building in Toronto, Ontario, Canada. Now, none of this would have been possible without the support of many individuals, including the Canadian Foundation for Dietetic Research, About Kids Health, a team of us at Sick Kids, but also the Canadian Celiac Association, who has allowed me this opportunity today to be able to share all of this with you. Thank you.